I am the founder of Serenity Healthcare Center, which is here in Waukesha. And my specialty is women's health. That is my love, but I also do a whole lot of other things too. So we're going to get started. I'm going to talk a little bit on the statistical things of breast cancer, why breast cancer occurs, environmental factors, and then Amy's going to talk about things that we can do to help the breasts. We're also going to have talk about lymphatic massage. We're going to talk about thermography. So we're going to kind of swap out each other as we're ready to talk about those things, okay? All right, so how many people have been to this lecture, our girls' night out before? Just a few of you guys. Okay, great, good. So how many of you know someone who's had breast cancer? Pretty much all of us, right? We all know someone who's been affected by breast cancer. We all have maybe some intimate close friends or family members that have been affected by breast cancer. So I think it's really important that we talk about why that's happening, why we're seeing it happen more frequently, and why we're seeing it happen earlier and earlier. And that's where my talk is based today. So we all know people that have heart disease too, correct? Mm-hmm. Yeah. We talk more about breast cancer than we do about heart disease because it's close to our heart, but more women suffer from heart disease actually than breast cancer, believe it or not. So two big topics, but today we're going to focus on breast cancer. So as we age, our cells get old. As our cells get old, genetically things start to happen. Our immune systems start to get weaker. And basically, our immune systems can no longer see the cancer cells the way they were supposed to. They're not strong enough to blast apart the cancer cells and kill them. And that's why we develop cancer. We make cancer cells every single day, I'm afraid to say. But with strong, healthy immune systems, they're like asteroids in there. We just blast them up, blow them up, get them out of there, and we do good. If all of a sudden our immune system's busy looking over here at something else, and we see these cancer cells here, but the immune system's doing this, it's not seeing this. And then this starts to have cell division and growth, and that's when we start to develop cancer cells. Okay? So vitamin D is crucial. Vitamin D is not actually a vitamin, it's actually a hormone. But vitamin D is crucial to building our immune system. It's very important. If we don't have adequate amount of vitamin D, we're going to have a more depleted immune system. If we have a more depleted immune system, we have more problems with cells that become old and damaged, and we can develop more cancer. Okay? When the conventional doctors look at a vitamin D level, they're real happy that your vitamin D level is somewhere around 30, but that is the low end of normal. The lab range goes from 30 all the way to 100. That's a huge span. Optimally, you want that vitamin D level to be somewhere between 60 and 80, even 90 is what we're saying now. Unfortunately, because of some of our environmental things, we do not absorb vitamin D from the sun like we used to, and we're not absorbing enough of it from our food sources either. So this is a really important thing to have tested at minimum, I think, once a year. There are certain people who will have a genetic mutation called a VDR mutation that they cannot absorb vitamin D from the sun or from food sources. And so even if they have a particular form of vitamin D, they still cannot absorb that. Those type of people are people who take a vitamin D in an oil form and their vitamin D levels are still really low. They need to have a special form of vitamin D, and they need to have a lot of vitamin D to get their levels to be normal. So if you're somebody who's been taking vitamin D and your numbers aren't budging, you may be somebody who has that VDR mutation and may need a special form of vitamin D then, okay? Okay, testing for breast health. We have mammogram, we have thermogram, and we have breast MRI. And we'll talk a little bit about both and the pluses and minuses to all of these, okay? So with the most recent statistics as of, I believe this is January of 2019 or December of 2018 or December of 2017, we are now looking at new cases of invasive breast cancer diagnosed this year, 266 plus thousand women. It's a lot of women. 63,000, just roughly under 64,000 new cases of non-breast and non-invasive. So that's something we call a carcinoma in situ. It's non-invasive, it's not aggressive, but there's abnormal cells that are present. There'll be roughly 2,500 new cases of an invasive breast cancer expected to be diagnosed in men in 2018. So we very rarely talk about the breast cancer risks in men, but it is there and it is gaining ground. So we have to look at men as much as we have to look at women. Some of that is genetic. The majority of it is environmental. Women who have had high amounts of testosterone when they were younger, we will actually see less risk of breast cancer in those women. The thought was originally because they had less estrogen, but that is not the case. It's actually the higher amount of testosterone. Those androgen hormones were very breast protective when they were younger. So oftentimes when we see women with high testosterone, we're afraid of that. We want to change that. In this case, it's good for them to have higher testosterone. And certainly we don't want them having super high testosterone levels where they're growing a beard and they're really angry and all of that. We don't want that, but it's okay to be a little bit high there, okay? So you'll know a woman that has a higher testosterone. They tend to be more straight. They're not curvy and voluptuous. They're more straight. They're flat-chested. They're a little bit more muscle development. They have a lot of muscle versus more soft, fluffy tissue. Okay, that's not important. So here is a study that kind of breaks down breast cancer by age. 1 in 8 women have a lifetime risk of developing breast cancer. This is increased 1 from 11 in the 70s, so we are seeing a much higher rate as we are getting further into our development of our country. I'll tell you my personal take on why that's happening in a little bit. You can see as we're 20 years old, it's 1 in roughly 1,700. So as we're younger, we don't see very much breast cancer development. And this is pretty much true of any cancer. When you're younger, you don't typically see a lot of cancer. The older we get, the more cancer we see. In part, that's the immune system. In part, it's because we've lived longer, we've had more exposures to things. We see that higher risk of rate. By the time we're 70, 1 in 26 women will develop breast cancer. Lifetime risk, 1 in 8. So it's good to live old. However, when we live old, we might have more problems. Okay? This is just a study that breaks down new cases of a variety of cancers. You can see breast cancer here at 232. This is last year's statistics. Deaths of breast cancer is about 40,000. About 15% of the women diagnosed with breast cancer will actually die from breast cancer. So kind of frightening statistics there. This is our mortality rate. Since 1990, the mortality rate has declined by 34%. So even though we have more people developing breast cancer, we do have less people dying from it. In part, it's early detection. In part, it's better treatment options. There's a whole lot of things that are making that better for us, but unfortunately still too many women dying from breast cancer and still too many women being diagnosed with breast cancer. The recommended screening is after the age of 40, annual mammogram, annual clinical breast exam, self-breast exam. How many people do self-breast exam on a regular basis every month? Okay. How many women do annual breast exams by somebody who is a practitioner that knows what they're doing? Okay. So those are really good things. There is some discussion that self-breast exam is maybe not the best thing to do because it creates anxiety and there's a lot of false, we don't know what we're feeling, so we get nervous. I don't agree with that. I think we need to know our breasts. Our partners typically know our breasts more well than we do for a variety of reasons, which is not bad. It's amazing to me how many men diagnose breast cancer in their lives because they know what their breasts feel like, they know what they look like. We're not always paying attention, but they do. And they will say, something's not right, something doesn't feel good. I've seen it happen over and over and over in the last 20 years that I've been doing this. Ages 20 to 39, clinical breast exam every 3 years. A little bit further out simply because the risk of breast cancer in that age group is less. And then clinical self-breast exam optional in younger women. Now the caveat to this is if you have a primary family member, a mom, a sister who has breast cancer, this goes out the window because then we want to see testing much earlier than this. We usually recommend 5 to 10 years earlier than your primary relative was diagnosed. So if a sister was diagnosed at 40 and you're 30, you're going to start screening at 30 instead of waiting until 40 or 50 to do that. Controversies to mammogram. There are some. They are a diagnostic tool. They are not a preventative tool. Let's be clear on that. They are meant to diagnose a problem. They are not meant to prevent anything, okay? Overdiagnosis, we start mammogramming women too young. Mammogram is meant to detect lumps in fatty tissue. Women who are young, who have a lot of dense breast tissue, they have hormones, they have muscly, dense tissue, mammogram doesn't do a good job seeing through that. Those of us who choose to use hormones, we have dense breast tissue. We don't have a lot of fatty breast tissue because we're using hormones. Mammogram's not so good at seeing through that, okay? More anxiety. A lot of women get anxious about having a mammogram. They don't like it. It's uncomfortable. They're nervous that they're going to be diagnosed with something. It creates a lot of anxiety and fear around there. We see a lot more biopsies being done when there's more mammograms. There's a lot of repeat mammograms because they see something, there's a shadow, they're uncertain, they bring you back, they biopsy. There's a lot of cost to it. It's not an inexpensive tool to do, especially if you end up coming back every 6 months for a repeat mammogram for somebody to monitor you. There is torque compression on the breast. We all know they're fun. They squish our breast. There is a lot of concern these days that the torque compression on the breast delivers roughly 10 pounds of pressure to the breast. That 10 pounds of pressure can cause a breast cancerous tumor to metastasize because it's too much pressure. So we were always worried about the radiation. It's actually the torque compression we're more concerned about these days than that. And then being done too early. I'm not a fan of having mammograms done too early. I think there's better tools that we can use besides just mammograms. This is just another screen of showing aging, ages 40 to 44, who should have breast cancer annual screening with mammograms if they wish to do so. We used to say, yeah, this is something you really should do. Now we're kind of leaving it optional. Age 45 to 54, they want mammograms every year. But why would we do that? 45 to 54, we still have hormones, we still have dense breast tissue. We're not going to see a lot through there. This is where we get a lot of that false positive stuff going on, or false negative. 55 and older, much better group if you're not on hormones. If you're on hormones, this group could have some issues too. But over the age of 55, if you're postmenopausal, that's where mammogram does a really good job at evaluating that tissue because we have fatty, more saggy breasts. Okay. Potential harms, callbacks, the anxiety, false positive biopsies, false negative screening. You can miss breast cancers in dense breast tissue. Radiation-induced breast cancer can occur if you're somebody who's in a cycle of getting multiple mammograms. I have known people who've had mammograms every 6 months for 5 years because they keep seeing something and they keep watching, and they end up getting a breast cancer as a result. I have seen women who've had one breast that's been suspicious. They're mammogramming that breast every 6 months, and they forget about the other breast, and guess where they develop the breast cancer? Because they stopped looking at the other breast. So those kinds of things happen with mammogram. It's important for us to be informed and know what breast they've been looking at when and how long's it been, and make sure that they're not forgetting. Overdiagnosis, the detection of cancer might not otherwise become clinically apparent. We are now seeing people being diagnosed with grade 0 breast cancer. That's a little concerning to me because grade 0 is 0. There's some cells there, but it doesn't necessarily mean it's cancerous cells that we need to do something with. So there is becoming more overdiagnosis, in my opinion, as well. So we already talked about this. There is a Swedish study that shows women in their 40s who have mammogram led to 29% reduction in breast cancer mortality over a 16-year period of time. So that meant that all these women in their 40s started getting mammograms. They followed them for 16 years, and they had less death. Well, okay. That doesn't mean that mammogram did that. It just means that those women had less mortality. Annual versus biannual screening. Annual screening leads to 30% lower recall rates in detections of smaller tumors that impact on a stage of migration. Screening ages of 40 to 79 is more cost effective than seatbelts and airbags, so they say. I don't know. So I will tell you a story about one of my clients who had breast cancer, was a 5-year survivor, was uncomfortable getting mammogram done, chose to do thermography. Thermography picked up something suspicious. I said, we need to do something other than mammogram. I'm concerned about this. Insurance wouldn't cover anything until she did a mammogram first. She did the mammogram. Mammogram showed a tumor, and they said, we're just going to watch it. Come back in 6 months. And I said, no, we're not going to watch it. We need to do something more. So we requested a breast MRI, which if I had my way, every woman would get a baseline breast MRI, and we do breast MRI every 2 years. It's the most effective diagnosis. It picks up things small. There's no torque compression. There's no radiation. It is the best, but we can't get it. It's $3,000 to do that. Insurance won't cover that. But we were able to get it because of her history. That MRI saved her life. That cancer that they were going to watch for 6 months was an invasive carcinoma. She would have been dead in 6 months had they not approved the MRI. She's still alive today. That was 4 years ago. So sometimes we have to have people that advocate for us, and we have to learn to advocate for ourselves as well. Sometimes taking a wait-and-see approach with somebody who's already had cancer is not the best thing to do. And this is where mammogram kind of misses things. Here's the breast MRI. So lifetime risk, 20 to 25% or greater. Breast MRI is really important to do with somebody who really knows how to do breast MRI. You don't want to do this with somebody who just does MRI. They need to be specialists in breast MRI. They need to have access to do biopsy, because if they see something on that MRI, you want them to be able to biopsy it right away. Okay? We used to have a couple of clinics around the state that did that. We no longer do. We only have the hospitals that do that now. Axilla area, we forget about that. That's our areas up in here. A lot of breast cancers develop up in this, we call it the tail. It develops a lot in this outer portion right up here. We often forget to look at that area with breast exam. It's a very difficult area to get to when we look at mammogram. So this is a very important area and region to look at. You have a lot of lymph tissue there. Kristen's going to talk about that. When that lymph tissue gets swollen or gets stagnant, we have problems there. So that's really important, okay? Thermography. Thermography is a heat-censored picture that we take of the breast. There's no radiation, there's no torque compression. There's a lot of controversy about using thermography. Thermography is not a diagnostic tool for breast cancer. It is a diagnostic tool to look for an inflammatory state of the breast or tissue that happens 7 to 10 years prior to us seeing mammogram. So this is where we can say, you know what? This can detect something's going on long before you develop cancer. But the great thing about this is we can detect this and we can start making changes 7 to 10 years prior so that breast cancer hopefully never sets in. Okay? Things that you can do to help support your immune system and prevent problems with breast. Fish oil. Fish oil is huge. EPA DHA has reduced breast cancer in 49% of women. It's a big thing. You want to make sure that you have good fish oil. If you burp up this nasty fishy taste, your fish oil is rancid. It's not. It's a bad oil. It's not that you have a digestion problem. If it's a nasty tasting oil, it's a rancid oil. You need to pitch it. If you just burp up a fishy taste, it's just that you're not digesting the oil, and then you need enzymes to help you break down that fat. Women with higher levels of EPA DHA have seen reduction in breast cancer by 73%. It's a very high number, so this is really important. It's also very good for your cardiac system. Sugar feeds cancer. White refined sugars, problematic. When women or anybody develops cancer, they go to the cancer centers, and the cancer centers tell them to eat whatever they want. Doesn't matter, eat whatever you want. No, you don't want to feed cancer. Yes, a lot of things feed cancer. Sugar is a #1 feeder. We want to keep it out. That doesn't mean you avoid fruits or sugars from vegetables. We're talking white refined sugar. That's the problem. They love to feed cells. Dietary changes. The question is always, what is the best diet? There is no best diet for everyone. It's a diet that's best for you as an individual. There's the GI diet, there's the blood type diet, there's paleo, there's keto, there's genetic diet. There's everything underneath the sun. When we're talking cancer, the genetic diet is much better than any other diet because we're basing it on your genes. Wayne Dyer, before he passed away, did this genetic diet and actually allowed him to live about 3 more years with the cancer that he had. He had leukemia. And he was able to live quite a long time and very quality of life because he did a genetic diet. It's called the APOE diet. And so you can do an APOE blood test. They typically use it to look for cardiac issues, but you can use it to determine what kind of diet you should have. How much fat, how much protein, how much carbs, where are you at. Works beautifully in cancer people. Cruciferous vegetables, very important for us. That's your broccoli, your cauliflower. You also find these things in something called DIM or IC3. This is something that women need to be on if they're taking hormones because it helps them filter their hormones. We call it methylating. It helps them filter it so they don't store it in their body fat tissue. It also works really well in pretty much any type of hormone-driven cancer. So ovarian cancer, uterine cancer, estrogen-driven. When we're talking about estrogen-derived cancers, we're talking about something called a 2,16-hydroxy-estrogen ratio. We want to make sure that you don't have too much of the 16 and not enough of the 2. So there is a urine test that we do to determine this to see if there's a problem if people have issues methylating. Anybody who has a family history of breast cancer that wants to use hormones should have this testing done before they start hormones so that we know that you're not having a problem methylating. Cancer prevention, so daily exercise. Exercise of any kind. I don't care if it's walking in place. Exercise, walk around the block, yoga, jump rope, any of that kind of thing. We need to move our bodies, okay? Proper diet, reduction of stress. Stress is a #1 component to depleting the immune system. Very important for us to figure out how we minimize our stress level, okay? Improve our immune function, vitamin D, vitamin C, ginseng. Those are things that can help us improve our immune system to keep it strong. As we get older, we may recommend something called thymucin or thymus extract. Your thymus gland sits in the middle of your chest. As we age, that depletes. That's a primary thing for our immune system. Some people, does anybody know about tapping? Yeah. So you tap the thymus gland to get it to stimulate to move. You can do that as well, but sometimes we want to really push that and we'll use a thymus extract for that. Proper evaluation of viral and bacterial loads. We all walk around with bacteria, viruses, and parasites in our body. If our immune system's strong, we keep them in check. If it's not, they go wild. They go wild, the immune system depletes, cancer cells can develop. There was a study done back in the 1970s that they took breast cancer tumors, looked at them under the microscope. The majority of them were found to be parasitic in nature. Today, the majority of our cancers are viral in nature. We have things called retroviruses. Viruses are now taking on DNA of bacteria. DNA is now taking on RNA of viruses, and it's getting very difficult for us to fight some of these things off. We can thank Monsanto for some of this. We can thank the chemical companies for some of this. There's a lot of blame to go around, but this is what's happening, so it's making it harder for us to fight and kill these things off. Parasite cleansing, I think, is good. I think parasite cleansing should be done like we spring and fall clean our house twice a year, do a parasite cleanse for ourselves. Everybody has parasites. We're not dirty people because we have parasites. Parasites live on a lot of things. We're all mobile people. A lot of people, unfortunately, don't wash their hands when they prepare food. We travel outside of the country. It's very easy to pick something up, not necessarily know you picked it up, come back here and have minimal problems, but not full-blown parasitic problems, but you can still have parasites. Proper nutrition balance. It's good to make sure you have good nutrient balance. There are some tests you can do, blood testing, stool testing, urine testing, to see if you have nutrient imbalances, and then we can concoct supplements to balance your nutrients instead of guessing. Sometimes it doesn't matter. Everybody's magnesium deficient, that's easy. But if somebody's really ill, we need to know how deficient they are. If you're really deficient in a lot of things, you probably have something we call leaky gut. You have malabsorption, you're not absorbing. We need to fix the gut so that you can absorb nutrients from your foods. Okay. Proper hormone balance is always important. Unfortunately, we live about as many years of our life in an estrogen dominant state from roughly the time we're 38 or 40 for the rest of our life till we die, where we lived half our life with proper hormones. So when we're estrogen dominant, even though our estrogen falls, so does our progesterone. Progesterone falls about age 35. Estrogen will stay consistent till about 45 or 50, and then it will start to fall. So we've got quite a few years there where we have a lot of estrogen and not a lot of progesterone. That's when we start seeing some problems with estrogen-driven cancers. Estrogen is not the evil empire. It's the synthetic progestins that we give in our environment that cause breast cancer. Certainly additives of estrogen in our environment, in our foods, in our chemicals, those things are not good. They're called xenoestrogens. Those are really bad estrogens for us. And if we don't do a good job with detoxing in our body, we are going to build up those xenoestrogens and we're going to have a lot of problems. So people who are, who's the one drink drunk in this group? You have one drink of wine and you're like, oh, I could fall asleep. Those of us who are like that don't detox very well. We need to make sure we're detoxing properly. If you're the person that says, yeah, if the doctor prescribes two of something for me, I take a half or one, you're somebody who doesn't detox very well. You need to make sure you're detoxing properly because you're going to be the person that's going to have the problem with these xenoestrogens. Measuring hormones. So women who are not on hormone therapy can measure hormones by blood, but once you're on hormone therapy, saliva is what you should be using if you're on a transdermal hormone. If you're on a sublingual hormone, salivary testing is not very good, then we need to use blood. You can do urine. I'm not a huge fan of urine unless we're looking at methylated hormones. Methylated hormones, urine is good, but if we're looking at balance and measurement, blood or saliva is really the way we should be going. Some people, they can't do saliva. We do saliva and it never matches their symptoms and it doesn't look right, it just doesn't work, then we have to adjust and then we have to do blood or vice versa. You want to supplement with proper hormones. We don't use synthetic hormones. We don't use horse-based estrogen urine, you know, like Premarin, Prempro. Those are estrogens our bodies don't have, and thank God we don't weigh 1,200 pounds. So we don't want hormones that feed a 1,200-pound horse. We want something that feeds a body that's 150 pounds on average, you know? So we don't want to use those type of hormones. We want to use bioidentical. That means the molecular structure is exactly like what the body makes. Okay, it knows exactly what to do with it. The other thing we don't want to do is we don't want to overdose those hormones. Okay, we want to give back the amount that the body produces in a 24-hour period of time. If we're starting to give back dosages of that of a 20-year-old and we're 60, we could have some problems. There is a whole group of people out there that like that want to do that. That's fine, they make that choice, but that's not what's typically recommended. Low dose, do what you need to do, keep it to the minimum of what the body produces in a 24-hour period of time. Leptin levels, so leptin is a hormone that can get triggered, and you know it's triggered because when you eat, you never feel satisfied. And you keep eating and eating and eating even though you're not full, just because you're not satisfied. High leptin levels are like high sugar levels, and they can feed cancer and things like that. We talked about vitamin D, proper insulin production. Insulin, blood sugar, they go together. Oftentimes, most conventional doctors will look at blood sugar. They don't look at insulin. You want to look at insulin. That's what your pancreas is producing to keep your blood sugar stable. You're going to see problems with insulin long before you're going to see problems with blood sugar. So if your insulin is rising to keep your blood sugar stable, we already have a problem with blood sugar, and we need to start implementing issues so that that insulin can be produced properly and not have to work so hard to keep the blood sugar in control. And then balancing cortisol. Cortisol is our stress hormone. How many of you have seen commercials saying cortisol is the reason we're all fat? I can tell you in 20 years, I rarely ever see people with high cortisol levels. Everybody is low. They're flatlined. They've burned the candle at both ends. For many, many years, they've raised families, they've worked, they've done this, they've done that, they don't sleep properly, cortisol flatlines out. It's just as much of a problem to have low cortisol as it is to have high cortisol. So keeping that cortisol as balanced is really important. Environmental. Environmental cancer, or environmentally exposed cancers, has really risen a lot since we started developing all these chemicals to clean and make everything smell nice, and Monsanto has created a lot of chemicals. If I die, you know Monsanto killed me. So Monsanto is the one who's created all of the things to keep our food from being eaten by all the bugs. However, what's happened to the bugs? Now they've all survived, and now we have a problem. Now we have all this genetically modified food, we have all this food that the bugs can't eat, and we eat that food. And so that's a big problem for us. So we usually recommend people try to do organic as much as they possibly can. The thing that you want to do organic is something called the Dirty Dozen. If you Google Dirty Dozen, it will give you all the foods that the Environmental Working Group really believes should be organic. It's things like strawberries, raspberries. It's things you can't peel. There are certain things that are much more dirty, so to speak, than others. How many of you love your wine? Yes. So it just came out about a year ago, the genetic modification of wine, and we are now finding Roundup in our wine.
Oh, nice.
So make sure if you're going to do wine, you do clean wine. Try to do organic wine if you can. They are also now finding Roundup in our vaccines. So we are having a lot of problems with that being put into the vaccine, and we're wondering why we're having vaccine issues. Some of it is the vaccine, some of it is the Roundup in there. Roundup is not our friend. If you need to kill weeds, there's an organic mixture you can use with vinegar and Dawn dish soap and Epsom salts, and you can spray it on your weeds, and it works beautifully. Okay. Plastics, all those soft plastics that we have, plastic water bottles, things like that, those things freeze, they heat up and transport. When they do that, they release chemicals called xenoestrogens. Those things create a lot of problems for us. So we recommend that you do not heat or store in soft plastic. Hard plastic is different, but our recommendation is usually to heat and store in glass. So Pyrex is like the best thing to use. Recycling numbers, if you're looking for things, 3, 6, and 7 are usually the symbols that you're looking for. Even though 1 is thought to be safe overall, plastic should be tried to be avoided as much as possible. Even the plastics that are on like your meat at the grocery store, you're better off going to the local butcher and having them wrap it in paper instead of having that all wrapped in plastic. And don't ever freeze it with the plastic on. Take it out, wrap it in freezer paper, do it that way. We do now have the ability to test chemicals. This has only been available for about 8 or 9 months. It's called a GPL tox. It's a urine test. So if you're concerned that you've been exposed to toxic chemicals, this is a test that you would want to do. We recommend doing this on anybody who has cancer or anybody who's having problems with chemicals. It will tell us exactly what chemicals you've been exposed to and to what degree you've been exposed to them. Certain chemicals are linked to certain types of cancer. They test about 18 or 20 different chemicals, so it's a pretty in-depth test. Relatively inexpensive. I want to say, Kayla, how much is the GPL test? Like roughly $250, I think it is, $219. Relatively inexpensive test to do to see if you have chemical exposures and get that cleaned up before problems occur. So detoxification. Detox is super important for all of us because we live in a toxic environment. Unfortunately, I don't think our toxic environment is going to get clean anytime soon. However, if we can grow hemp in large amounts, that will be great because 1 year of a hemp crop pulls out all of the toxic chemicals out of the soil, and then you have clean soil. You want to optimize glutathione production. Glutathione is an amino acid. That is what helps us detox in our system. You can use glutathione in a topical form. You can get it in something we call a nebulized form. You can inhale it or breathe it in or breathe it through the nose, or you can do it IV. For really sick people or people who have a lot of chemicals, we usually recommend this to be given IV. If somebody's just looking for something to use on a regular basis to move chemicals, topical is great. It's a product called Axilla. It's made by a company called Apex. Works great. Remove our parasites. We talked a little bit about that. Detox pathways. How many of you have heard of MTHFR? Okay. MTHFR stands for methyl tetrahydrofolate reductase. Hence the reason we say MTHFR. This is a pathway of detox. It is not the main pathway of detox, but it is the biggest one that's out there right now being talked about. It is how you methylate B vitamins and folic acid. Okay? So for people who have an MTHFR mutation, they cannot convert B vitamins to their active form called methyl B. They also cannot convert folic acid to folate. Very important in people who are getting pregnant if they have this mutation, because they can have a child with special needs because they can't convert folic acid to folate, and we need folate to close off the spine. Okay? So this is a blood test that you can do. You can also get it done by saliva test, relatively inexpensive. It can be done for about $40. You can see if you have this mutation. If you have this mutation, you need methylated forms of B vitamins and methylfolate. That'll help you move those toxins. And that is all I've got for you. Amy, you're going to go next. Kayla's going to go next? Okay.
We're going to pass around breasts. There are some irregularities in here. We encourage you guys, we're not going to tell you how many, but let's see how many you feel. So just like you would do a normal breast exam, we'll start here and just pass it around. Then we'll talk about
Or do I click this?
Oh, you just click here.
Oh, that could be dangerous.
If it's just forward or backwards, so if you click too fast, you just click that. That one.
Ah, I got it.
Yeah.
I don't know if this is it. I got a loud voice.
All right, there you go.
All right, so my name's Kayla Giorno, and I do the thermography through Midwest Thermal Imaging. So we're going to talk about the breast thermography today. Does anyone know what thermography is or who's had one before? I see some faces here. So quite a few. This is really small. So thermography looks at the temperatures through the skin surface. It converts infrared radiation that's emitted from the skin into electrical impulses that are visualized in color. We use a company called Meditherm. What I think they stick out from anyone else in the thermography industry is because it's not me reading your image. It's a certified MD who has 8 years of schooling, plus 8 years on top of that degree to read thermography solely on their own. I don't like the idea of just your tech reading that because there's a lot that I can see and a lot that I don't. So I leave it up to them. So it's going to map out the temperature and show us different patterns as well as different temperatures. White is going to be your hottest temperature. Kind of goes down the scale of red, oranges, yellows, greens, blues. Obviously the hotter, the white and reds are inflammation areas, and the cooler areas are not. So those spectrum of colors kind of depend what's going on within the body as well as different patterns at different depths of the body. So that camera will go through the whole depth of the body to look at all of the organs, your muscles, nerves, bones, all of that tissue. So thermography can tell us anything vascular, muscular, skeletal. Helps us define the extent of lesions, which a diagnosis has already been made, or to help us with a diagnosis. Obviously, that's going to be confirmed with another form of testing as well. And we can also use it to monitor the healing process. So what we can use it for: breast health, adrenal dysfunction, injuries, oncology, pediatrics, thyroid, allergies, fibromyalgia or pain, those kind of things. Different trigger points: arthritis, inflammation, stroke screening. It's interesting, I had a patient who came in for a breast thermography and she had a bright white line straight down her neck. And you don't see that very often, which triggered me to take a few extra images, and she had no symptoms at all. It came back that she had elevated CRP levels and a risk of, inflammation in her carotid artery. She had an ultrasound confirmed and she had 100% blockage with no symptoms at all. So she's basically a walking stroke waiting to happen. So it was kind of awesome that we found it with a thermography since she had no symptoms, and she was able to have procedures and take some lifestyle changes to prevent anything. You can look at nutritional disease as well. So what can the thermography tell us breast related? It can tell us if we have fibrocystic activity going on. When you come in for follow-ups, is that activity getting worse or getting better? Lymph congestion, which is huge. If we have congested breasts, our breasts are not as healthy as they should be. It'll tell us if we're estrogen dominant or not. Myofascial inflammation, that system can cause a lot of other issues throughout the body as well, and those cell changes. So it can detect cell changes 7 to 10 years earlier than a mammogram can. Like Dr. Mew said, then there's different things we can do to prevent that from turning into something more serious. So the early detection of change can lead to the early diagnosis and better treatment options. This is kind of what a normal breast will look like on a thermogram. This is where there's inflammation, breast cancer in that breast. So you can definitely see the one side to the other of how different that is. Estrogen dominance, a lot of inflammation almost throughout that whole chest area. They'll show you immune dysfunction, which looks kind of in their back area too. Male breast cancer, so you can definitely see all the inflammation and then how cool it is in that breast as well. And then there's some shoulder pain and that sort of thing, just so you can kind of see those differences within the images. Again, they kind of have normal breast to abnormal. Normal symmetries of healthy breasts. So you can basically, you want that image to look similar from one side to the other. When there's differences in that image, that's where usually there's a concern. This one's just looking at pathology, whether it's cancer, fibrocystic disease, an infection, or vascular. So they're kind of looking in that area a little bit more. This is like thermography versus ultrasound, so looking at this area here and then confirming with an ultrasound of that spot found with the thermography. Again, they're kind of the same. Inflammation with the right breast, ductal carcinoma, which can be pretty invasive too, which can be hard to find in other testing when it is ductal cancer. So you can actually see that stands out pretty good on this thermography. And this one shows those fibrocystic changes in the left breast. They show some heart disease, pre-stroke, where there's all that inflammation in the neck there too. Carpal tunnel, dental stuff. This just kind of shows cell growth for tumors. So thermography can catch it at the 2-year mark when you have about 256 cells. That would be a cancer cell, where mammograms waiting till almost the 7-year mark. So those cells have been growing for that amount of time before it's detectable. With thermography, there's no radiation. It's hands-free, nothing touches you, there's no pain. And then early detection saves lives. And then just some images again. So these are the 5 images that you would have done in your imaging session. You are obviously undressed just from the waist up. The camera is usually a couple feet away. Everything's with arms up so we can see all angles of the breast. It takes about a week or so to get the results back. If there is a major concern, we would send that urgently and we'd have that back within a 24-hour period. They're pretty detailed in their reporting, which is very nice. Usually it's in terms kind of all of us can understand. Otherwise, we always have the provider look over it and just make sure that we don't need to order anything right away. Any questions on the thermography? Are we waiting for that, the answer?
I had one done last year.
Mm-hmm.
And came out fine. But then they wanted me to come back in 3 months to get a baseline.
Yep.
So the first one was the baseline.
So they will recommend for the breast portion to come back in 3 months to establish a baseline because they want to capture those cell changes in a 90-day period. Because usually your cells will change in 90-day increments. So that's why they want to capture it again in 90 days to make sure that nothing has changed. And then they have a comparative view to look at that with. Otherwise, they have nothing to compare it to. So then they make sure that's kind of how you look. Because every one of us in this room, our breasts will look different from one another on a thermogram. Where I may be more inflamed, some of you may be a lot cooler in those areas. So that's why they want to just make sure nothing's changing.
So if you didn't have anything the first time, and you came back in 3 months, and there was a 90-day change, what do you do when you only have less than 300 cells?
If there is a change, they'll let us know what that change is, and they'll recommend if further testing is needed, or different things to do from there. Yep. All right. Any other questions?
So you said you can see things like you saw the thing in the back.
Mhm.
Do people come in for different kinds of thermography?
Yep, people come in and do a full body scan, and it looks at everything in the body except the brain and the genitals. Simply, the brain is a whole nother world, and the genitals are frankly too hot to be able to image those in those areas. But yeah, they will do full bodies. It'll look at the whole depth, all of our organs, and that whole system.
Is it a much bigger cost?
The full body is $275, and then the initial breast normally is $150.
And do you need to have a follow-up appointment, or will you just call?
Yep, we'll just call you, and usually I'll email you a copy of the results so you have the report and all the images that are taken for your records, and then for you to give to your practitioner. Some practitioners aren't familiar with thermography, so they may not take it as seriously as others will, but there are a lot of physicians that will take it for what's there.
I just wanted to say that this price is a really good deal because I just had it done last year. Full body for $600.
Oh my.
And this was in Menominee Falls. Won't say a name. We all know where it is on the main drag. And
Yeah, we do animals too, and I charge $300 for a full body horse, which takes me a long time. So we have horses too.
I just wanted to say also how detailed that is because a couple weeks before I had a cortisone injection in my knee, and here on the thermography thing was a little tiny red spot where it showed, even though I felt nothing, there was still inflammation right there.
Yep. They had a couple pictures of someone who had acupuncture done on their knee, and they took images like every 5 to 15 minutes through the acupuncture session, and how much the inflammation decreased was amazing just while those needles were still in. It was very interesting to see.
So is there any hope that insurance companies are going to start covering them?
I hope so at some point, but I doubt it. Yeah.
So do you think that the, more or less the doctor that's going to take this more seriously would be like a gynecologist versus a regular physician? Or
More on your holistic integrative end, possibly. I've had a few conventional doctors and patients come in and their OB took it for what it was, and just still talk to them about other forms of breast testing, which is still important to do. It does not replace a mammogram. It's definitely a good early detection tool to use with other forms of testing.
How long has this been around, thermography?
At least 20 years.
Oh, really?
Yeah, Meditherm's been around for 20 years. Long time.
Thank you.
I always have to bring my notes if I don't refer to them. So I see a few familiar faces out here, but for those of you who don't know me, I'm Kristen Schwengel. I'm a massage therapist. I work with Amy Beyer, who will be talking immediately after me at Natural Balance Therapy, which is located in Pewaukee. Myofascial release therapy, which Amy will be talking about, is the core of what we do and what I do. But I've done a lot of training in lymphatic care in the last 8 years. And I really love working with the lymphatic system. I've used it with a lot of my patients, particularly those with chronic inflammatory conditions, chronic inflammatory illnesses. And so what I'm going to be talking about tonight is the lymphatic system. We'll do a little bit of anatomy, I promise, not too much, and you don't really need to remember it all. You know, there will not be a quiz at the end. But how important the lymphatic system is for overall health and breast health in specific. Now, when someone says something about the lymphatic system or lymph to you, what's the first thing that comes to mind? Yes, the lymph nodes primarily in the neck. That's what people usually think of. That's what gets inflamed when we have a respiratory infection. And you know, you may also think about the nodes in the armpit or in the groin, which are used in cancer diagnostics to see if a cancer has metastasized or not. So the lymph system, it's made up of a lot more than just the nodes. It's everywhere in our body. So what is this stuff anyway? And it's, you know, if you've ever had a blister that's broken, that kind of thin, clear stuff that seeps out, it's basically lymph. It's, you know, basically it's a thin, clear fluid, and it's mostly water. It's 96% water. You know, a little fun factoid, coffee is about 96% water. But think about what a difference that 4% makes between a glass of water and a cup of coffee. It's a huge difference. So that's what's going on in your lymphatic system. We've got this 4% of other stuff that is so important. We've got minerals in there. We've got proteins, lipids, the immune cells. It's actually how the immune cells get to everywhere in your body as through the lymphatics. And also the cellular debris, the waste, the gunk. That's how it gets picked up. It's through the lymphatics. That's that 4% is really making a difference. So the lymph is kind of this medium. It's a transport medium. It goes from the blood to the cells and then gets picked back up, gets filtered through the nodes, and gets cleaned out via the urinary system. So it's really important to keep that moving. So this picture, and you know, probably those in the back don't really get to see very much. This is a really super simplified image. This is just the major nodal groups and the major pathways. If we were to try to show you everything, we'd basically be looking at your body because it's all under the surface of your skin. It's everywhere. So this is just the real simplified area, and you can see where you've got, you know, the lines of the major vessels and pathways, and then you've got these clusters of nodes kind of in the groin, in the knees, and there's a lot in your abdomen, and then the armpits and the neck. These are those major cluster points of nodes. About 70 to 75% of your lymph fluid is just under the surface of the skin. So that's where, you know, if we looked at everything, we wouldn't see any difference. And the rest of it is in the clusters of nodes in the joints and the abdomen. And we have between 400 and 700 nodes. So there's a lot of them in there, and they're varying sizes. Some of them are just a millimeter, some of them can go up to a centimeter. Those are usually the deeper ones, like in the abdomen. Those are the larger sized ones. The kind of pearls of life, they kind of look like pearls knotted on a string, and that's where they get that reference. Sometimes you'll hear, you'll see it referenced as the pearls of life, or the lymph nodes knotted along the vessels. Now, it's going to be, again, hard for the people in the back to see, but this is a one-way system. It only goes from the outside in, from the legs up. There isn't a pump like the heart. You know, our circulatory system, we've got the heart pumping to move the blood through. There isn't anything like that for the lymphatics. They move by much slower kind of secondary pathways. Skeletal muscle contraction is one of the things. The action of walking and moving and deep breathing kind of squeezes the fluid along. That's one of the ways that it moves. So it's really important to keep everything open and keep it moving to support all of the functions that the lymph has. So, why is it so dang important? I like to think of the lymph as the lymphatics as the body's vacuum cleaner. It kind of picks up all the gunk, the stuff that your blood can't pick up, the proteins, the metabolic wastes, all of those pathogens, all that stuff, it picks that up. And then the actual breakdown happens in the in the lymph nodes is where the pathogens, bacteria, and everything are actually broken down. That happens in the lymph nodes. And so it's just a really, really important part of your immune system. And of course, because of its being the medium to bring nutrients to the cells, it's really important for healing after injury or surgery. I mean, that's why we get inflamed. You know, you sprain your ankle and you get puffy. You know, it's because your body is doing its own protection thing, and then also it's bringing extra nutrients to the area because it knows it needs it. So then we want to, you know, have it be there. The inflammation initially is not a problem. It's only a problem when it hangs on too long after it's no longer necessary. And so we want to keep it, again, keep it moving, keep that mobile, and keep it functioning well. So, how does it all relate to the breasts? And this one kind of shows a little bit closer up the anatomy of the lymph nodes around the breast. You can see there really aren't any on the breast itself, but you have nodes that go alongside the sternum. There's some nodes underneath, and then of course the nodes in the axilla. Those are really important. And when you think about it, you know, when I talked about the movement being the skeletal muscle contraction, there's no skeletal muscles that go over the breast. This isn't muscular. Yeah, so how does it move? It's all just by pressure differential, going from high pressure to low pressure, draining towards those nodes. So we want to make sure that those nodes themselves are clear so that they can continue to draw from that area, because there just isn't that muscle squeezing happening that you're going to get in your arm and in your legs, because we can move, we can walk. That doesn't happen over the breast tissue. This is also why, you know, fluid tends to accumulate in the breasts, and also why poorly fitting bras are kind of a problem, because they compress things, they limit movement, especially in that lower area. So we want to make sure that things are fitting well. Doesn't mean that you can't wear a supportive bra and that you have to go braless, but the idea is that you have a well-fitted bra so that it's not creating a restriction around the area. And if the fluid isn't moving, then you get the issues associated with the chronic inflammation, you know, sort of some of the things that Deb was alluding to earlier. When things are not moving, that's when you get that likelihood of those mutated cells hanging around, not getting to the exposure to the immune cells, and not getting cleaned out by your body's natural protective mechanisms. So, there we go. So it can be really helpful, improving the lymphatic movement can be really helpful for the breasts for a number of reasons. And one fairly obvious one is reduced menstrual swelling and pain. I mean, that's pretty obvious. If you've got inflammation, you want to clear that out, that's going to make things a lot less tender. In a similar way, it can be helpful for women who have tenderness in the breast when pregnant or during breastfeeding. Helps manage the swelling and can actually encourage lactation and to improve healing from any breastfeeding related injuries or irritation. Fibrocystic breast disease, again, it's an inflammatory response. Non-malignant lumps can be alleviated with lymphatic treatment. And for many women, these fibrocystic lumps can be irritated with their menstrual cycle. So anything that helps calm the irritation and the inflammation from menstrual swelling is going to help alleviate the discomfort from fibrocystic breast tissue. Lymphatic congestion, this will show up on the thermogram. And that, you know, a lot of times the thermograms will come back and they'll show lymphatic congestion in the axilla, in the neck, various areas. And so then the thermographer will sometimes recommend having lymphatic treatment to help with that area. I had one patient who was referred to me by another thermographer, and she actually brought in her thermogram image for me to look at before our session, and it was fascinating because this patient had no pain, no symptoms, no discomfort, nothing. But when you looked at the thermogram image for her axilla, the left axilla was almost solid white, which Kayla said, you know, as Kayla said, that's the inflammatory response. it was almost solid white, and the right one was very normal, you know, some oranginess, but not too bad. And so she had no symptoms, no discomfort. And so I treated, and it was really fascinating to feel the difference between the right and the left as I was treating her. And then once I was able to point that out, I said, see, feel the difference, because I treat bilaterally when I'm treating in the armpits. So she could feel the difference in how her body was responding to the treatment between right and left. And she says, oh yeah, I guess the left one does it. I don't want to use the word hard, because that makes people think, oh, it was this nasty hard lump, but it was so thick and full. There was a ton of resistance to my hand when I was doing the treatment. And then, fortunately, it moved really well. It responded very well to the treatment. And then she had her follow-up 3 months later to get the baseline, and her left side was almost completely normal. There was no, I think it was a little orangey red yet, but it didn't have that white hot area of inflammation. So with the lymphatic congestion, lymphatic support treatment can be really, really good for that. And then also post-surgery for breast or any surgery anywhere, you know, because you want to restore healing and mobility afterwards. And in fact, I talk a little bit specifically about surgery and lymphatics because it's so important. Anytime you have an incision, you're damaging the lymphatics. Remember, they are tiny and they are everywhere. So anytime you cut the skin, you're damaging them. Now, what happens, they do regrow, but not generally over scar tissue that's more than 1 millimeter thick. And when you think about it, 1 millimeter isn't that big. So anytime you have that kind of scar tissue, your body has to reroute around it. And it's pretty good at doing that, but sometimes it just needs a little help. So we have that inhibition to regrowth. So we need to help support the system. And so whenever we have a surgery as part of the healing process, inflammatory response is natural, that's normal. But what we want to do is we want to keep it moving. We want to keep the fresh fluid coming in, and so it doesn't get stagnant and pool. So first, you're going to reduce that inflammation. That's going to help reduce your pain levels. And then you're actually going to help speed up the healing by bringing in fresh fluid. It gets this turnover of the supply, the nutrient supply coming in, and that accelerates the healing process. And then keeping things moving like that helps reduce the amount of scar tissue, and it helps improve the mobility of the scar tissue so that we can get better outcomes. And it's good for a whole lot of other health benefits. I've been using it a lot with patients with chronic inflammatory conditions, things like fibromyalgia, chronic fatigue syndrome. I get really good results with these patients. I've also been working quite a bit with patients who've been suffering with chronic Lyme issues. It really helps support their system, especially if they're doing a med change, because there's different sequences. I don't know if anybody has friends, family who have gone through any of the sequences for Lyme disease, but when it gets to that long-lasting phase, they're often cycling on and off various medications, supplementation regimes. There's a whole lot of different treatments. And what a lot of my patients have found is that getting lymphatic treatment shortly after they start a new med cycle helps their body clear out that gunk. Helps them with that, I hate using the word detox, but that's kind of what it does. It helps get that gunk out of their systems after they have a bacterial die-off. And then also post-injury, not just surgery, but injury like sprains, things like that can respond really well with the lymphatic work. And also enhancing general immune function or seasonal allergies. I've worked with patients who have seasonal allergies. I haven't made anybody not allergic yet. Sorry, I'm good, but I'm not that good. But what I have had is people who have had reduced severity of symptoms. And one gal was able to get through without doing the allergy shots. She didn't have to do the prescription stuff. She could just manage with the occasional over-the-counter for her seasonal allergies rather than having to get the prescription work. So it's like you can take down the severity of it. And then also I work with digestive health. because, again, we've got a lot of inflammatory conditions that affect our digestive health. Irritable bowel syndrome, some of the other ones. So, if you're thinking about doing that, when's the best time to do it? Post-injury, non-acute stage. Acute stage is generally considered to be 24 to 48 hours after an injury has happened. This is like things like the sprains that we're talking about. So, after that 24 to 48 hour period, that's when lymphatic treatment can be really helpful to help, kind of calm the system down, support healing. Post-surgery, I like to wait 7 days just to kind of make sure things are a bit stable. I will always modify treatment to avoid any incision sites because, well, we don't want to stretch the incision because it needs to heal. We aren't going to do any really direct hands-on treatment to an incision site for at least 6 to 8 weeks until things are nice and stable. But we can do a lot around the area to help it out. If you're having menstrual cycle, fibrocystic breast issues, I usually say a few days before you typically start to notice symptoms to kind of help forestall that. Chronic inflammatory stuff, anytime. The one exception is that if someone has rheumatoid arthritis, if they're in flare, we modify it. We don't do treat the flared area. We can treat other areas. But other than that, with a chronic pain condition, I can do the work pretty much anytime people are feeling up to it. And then for immune function, kind of that seasonal transitional phase with seasonal allergies, probably in a couple of weeks before, some people have their worst time is spring. So then I'd say come in maybe a couple weeks before the spring allergy season starts to hit. So what can you do? Because, there's only one of me, and you're with you a lot more. And there's a lot of things that you can do to help support your lymphatic system. So these are things that I do and suggest to my clients. And I think this is all on a handout in the purple folder, so you don't need to be scribbling frantically. Because I think it's all on the, there should be a lymphatic health at home handout. So first one is physical activity. Because you don't have a pump like the heart, we need that skeletal muscle contraction. So I recommend gentle walking. If you have a rebounder, one of those mini trampolines, those are fantastic stimulators for the lymphatic system. I've got a number of patients who love that for their system. So just gentle movement. And then I'm actually teaching a class in mid-October, and I think that's also on one of the handouts in there. It's, I think, October 15th. It's called Lymph Flow Exercises. It's a combination of stretches and movement activities to help stimulate the lymphatic system, open up some of your major pathways, get things moving, so it gets really targeted. Another thing is receiving lymphatic therapy. It's a gentle hands-on method to stimulate the lymphatic system and help move things through and help clear out some of the restrictions and blockages. Adequate hydration. Remember, it's 96% water. So you want to make sure you're getting enough water to keep it thin and mobile. It's easier to move soda through a straw than a milkshake. So if you kind of think of that, you want to stay hydrated. Good nutrition. Now, Deb gave a lot of really great things. Everything she said that's good for your body, yeah, that's pretty much good for your lymphatic system. We all know it, fresh fruits, fresh vegetables, all those healthy, good things. We know it all. That's what you want to help for your immune system as well. And then also for skin health. The skin is our major organ of detoxification. So if we can help our skin out, that decreases the load that our lymphatic system has to take care of. So some people do Epsom salt soaks or sauna. Infrared sauna is really fantastic, and they actually have one here. So if you want infrared sauna treatment, make an appointment here. They actually do it here. I think it's an hour, but I don't know how much it is. So they have different ranges, but you can just contact MD Custom to figure out the details. But sauna can be really helpful for supporting the system. And then the other thing, and you all have in your gift baggie, is dry brushing for the skin. So You all have one in the bag. I'm just going to show you briefly, and there is on the handout, I think that also goes through step by step the dry brushing. I like these four bristle ones because they're not too hard. Some of the other ones are really firm. These have a little bit of softness to them. You don't want to use too much pressure. You know, a lot of people will sit there and scrub and scrub and scrub. That's not the way you want to do it. What you want is just really light, gentle movements. You know, and I don't use a whole long stroke. I just kind of take it very gently, short strokes, always moving up towards the collarbones. Sometimes you'll hear people say about towards the heart. It's the same general vicinity. So it's just this gentle movement. Avoid any areas of irritation, like if you have a cut or sores or eczema. Avoid it. Don't go over that. Give yourself a favor. You obviously don't do the genitals. You know, I'd like to think it's obvious, but yeah, just really gentle up and just what you can reach. You don't have to sit there and try to contort yourself to reach to the back. Hit the front of your body, and everything from the back wraps around to the front. I generally do not directly dry brush my breast tissue, but I will go up the sternum, so I'll come kind of vertically up, and I will make sure I get the armpits too, coming up to the armpits and up to the collarbones. Don't do this on your face or your neck. It's such delicate skin. This is, even though they're soft, this is not soft enough for your face or neck. So be a little bit more gentle with that. You can, and then afterwards, of course, I usually do it before a shower, or you can take a bath, just kind of cleanse everything off. I do it a little bit more frequently in the winter months. I don't tend to dry brush a lot in summer, but it's great in winter. It's also a wonderful exfoliant, which is just great for your skin in winter. And then you can actually moisturize and moisturize the good skin underneath. So, support your local lymph because you've got a lot of it and you need it. Free or die. So it's your body's vacuum cleaner. It's so important. So, and I think we're going to hold questions for the end. So, I will back out of this.
Do you need me to? That's just pop that in your pocket. That's the main thing.
How's everyone doing? Do you guys want to stand up for a moment and do a little stretching? We've been sitting for a while. So you can just do a little bit of movement, stretching. If you want to, you can bounce up and down, call it jiggling. Gets us a little bit awake and our lymph moving. Right, Kristen? Okay. You guys can keep standing or you can sit. I'm open to either. Oh, you got a good chair.
I did.
So coming early does, right? Okay. My name is Amy Beyer. I'm the owner of Natural Balance Therapy in Pewaukee. And my talk will be more on the soft tissue implications for breast health. So our objectives today, we're going to talk a little bit about research, but then we are going to talk about the fascial system and how it impacts our breast health. We'll also talk a little bit on prevention, as well as how we help people get a positive recovery if they are going through breast cancer and or after breast cancer. So starting with a little bit of research, there's a professor by the name of Minda Bissell. She's a renowned breast cancer researcher at Berkeley University. And they took two different cultures of cells. And the first one, they just allowed them to grow in a normal growth environment. We can all guess what happened. The tumors just continue to increase in size. Then they took another set of cells and they manipulated them. They started to compress them and do different things to them. And what they found is the cells actually started to change. What the cells started to do was actually start to revert back to normal cells. And the importance of this in the myofascial world is that growth environment that they allowed it to grow in mimics the fascial tissue within our own bodies. Thank you. So kind of in summary with that is when we have potentially a tumor within our body or within our breasts, they may not develop into a malignant tumor. And what they found was it really is dependent upon that surrounding environment, which is our fascial tissue. In order for these cells to grow and have normal, healthy patterns, what needs to happen is that fascial environment needs to be hydrated. It needs to be fluid and flexible and mobile. This allows those cells enough space to be able to do what they're meant to do. So, how many have heard of fascia? Good. So there's a lot of things out there nowadays that a lot of people have heard about it. So the fascial tissue is our connective tissue in the body. And some of you are looking over. So it's the connective tissue in the body, and it has a similar appearance like a 3D spider web going throughout the entire body. It covers and interpenetrates all of the cells, the muscles, and the organs. So all of our cells are embedded within this fascial tissue. So an easy thing to think about is most of you have probably eaten or seen an orange. If you look at an orange, you have this beautiful orange coloring on the outside, right? And when you start to peel away that, you have this white flecky stuff underneath it. That symbolizes the fascia within our body. But then if you cut that orange in half, you have these beautiful slices and wedges that would symbolize like our muscles, an organ, and they're separated by some more of that white flecky stuff. And then if you take out one of those wedges, we have the white striations going through it. That is our fascial tissue down to the cellular level. So that's it. Next time you eat an orange, take a look at that and think of your bodies. So all of our cells are embedded within this fascial tissue. So if we look at that web a little bit further, there's 3 portions to it. We're only going to really worry about the ground substance, but we'll talk about the other ones. Collagen is a plastic-like structure. The elastic portion is kind of springy, has some flexibility, but the ground substance is that fluid nature that the cells are within. So that is almost like a jello type structure. So many of us have had things happen within our lives where we have gotten a disruption in our web or we've developed restrictions within our bodies. So things that may have happened, all of us have had them. Trauma. So it may be a car accident, a slip, a fall, an injury at work. Maybe we've had stress in our lives, whether it be physical or emotional stress. Postural changes, inflammatory cycles, all of these can start to affect this system that we have within our body called the fascial tissue. Now from a cellular level, what starts to happen at that ground substance is that jello-like substance actually starts to dehydrate. So remember I said it needs fluidity. And so when that starts to dehydrate, what will happen is it will start to stiffen. It will start to adhere and stick together. And then those cells start to come together, they decrease the space between them. And what will happen is those cells lose the ability to then communicate with each other. So if we look at kind of cells from let's say a normal tissue, so this would be normal breast tissue. You can see kind of that there is spacing in between the cells. This is what they should do. This is what they then can communicate back and forth with each other. But then once we start to develop more of what they would consider a cancer, what's happened is that ground substance has started to dehydrate. Those cells are being pulled together. They're starting to stick together. That's what they see as cancer. Does that make sense to everyone so far? Okay. How many, just by a show of hands, have had cysts in their breasts? So high percentage of us. Pretty common for most of us. In the myofascial world, what we feel cysts are a fluid-filled sac that gets encapsulated within a fascial restriction. So does anyone think that they can change? They can. I am someone that I had fibrocystic breasts pretty much my entire life. I am now not affected by them at all. A lot of it is, I feel, is due to the myofascial work. I don't have any cystic pain or tenderness anymore, which is wonderful. I like at this time to kind of go through one of my client stories. So we had a client come into our clinic. She actually didn't come in for breast work. She came in because she was having, I think it was back pain or hip pain or something like that. And through our time together, she had gone to get her twice-a-year mammogram because they kept watching and monitoring this spot. And she brought it up to me, and we talked about it because she was tired of getting 2 times a year mammograms. She was tired of the biopsies that they'd done on this spot and continuing to not get any change in it. So we talked about the myofascial work. I think I saw her maybe 3 or 4 times for it, and then she was phenomenal at learning how to do it on herself at home, and she was very consistent with it. And then a little while later, she came back, and she was thrilled. She went in for her twice-a-year mammogram. They found nothing. It was gone. So they didn't have to then go in for any type of monitoring anymore. And she was obviously very ecstatic. This is the first time in years that she had noticed any type of change. And of course she brought it up what she was doing to the doctor at the time, and they just kind of poo-pooed it for her and said, oh no, those just go away. But that was the only thing that she changed, is she added in the myofascial work. So we really do feel that that made a significant difference in her life. So there's another research out there from Gerald Pollack. What he was doing is within that breast tissue, he was performing prolonged pressures and pulling on the tissue, kind of what Minda Vassell was doing, which is basically manipulating and compressing that tissue. And what he was finding as well is that jello-like, what we would call the ground substance, started to become more fluid again. As they elongated the tissue, they started to notice more space happening within the cells, improving cellular communication, so the things that we were just talking about. They also noticed that those cells started to revert back to normal again. So this is 2 studies that kind of confirm that same thing of changing that environment really did start to change what was happening with these cells. Now, when I say this, you guys, I'm not saying we cure cancer. I want to be very clear with that. But when we can help people in really early stages, we have had, through this work, seen people that their tumors have gone away. But I also look at this from the aspect of, just like Deb said, we're developing tumor cells all the time. And so if we can do whatever we can from a preventative standpoint, that's what my hope is that we can do some of these things and prevent any of those things from changing to malignancy. So myofascial release is exactly what this is talking about. It is a sustained pressure or pull into the system. And that's what both of these researchers are talking about, and this is the type of work that is eliciting these changes in the ground substance. I know there were a lot of you that had seen people or known people or gone through breast cancer yourself. I like to talk about, hold on one second. Oh, I knew I missed something. So at this point, I like to share my story. 8 years ago now, I was in Deb's clinic getting my annual physical, and we all know that part of it is a breast exam. At that time, Deb actually found a lump in my breast, and she said, "Have you noticed this?" And I said, "No." Deb and I are friends, and so she left the room, came back. I said, "Deb, give it to me straight. What do you think?" She goes, "I don't like it." So we're going to go to the breast at this point, and then I'll finish my story. How many people felt nothing? How many people felt one thing? 2? 3? 4? More than 4? So there are actually 3 things in this breast. And if you want to, we can hand out the sheet, and I can bring this around again. But basically on the top portion, is a fibrocystic area. Here is an actual tumor. And then, Doug, give me the name of this one again. It's on the sheet back there.
The one right in the nipple you want?
Yeah.
That's a plug, like tuber stuff.
Okay, so there's a little, if you go across, there's a duct in there. So on this side, did anyone feel that pea-sized lump that kind of is mobile? That's what Deb found in my breast. So if anyone, I'm going to pass it around again. If anyone wants to feel those, they can. So at the time, I had been receiving regular thermograms because I was, I think, only 35 at the time. And so I had been receiving thermograms since probably my late 20s. And we decided to do a follow-up thermogram. It didn't really show any changes. So Deb had said at that time, she said, you know, Amy, I really think you should get into an ultrasound. So I scheduled the appointment. And unfortunately at that time, they were adamant, I will not do an ultrasound unless we do a mammogram. I didn't want a mammogram. I was 35 years old. I didn't want one, but I had to go through it because that's the only option I had, I felt. So I want to backtrack to leaving Deb's office. You know, when you find something in your breast, it can be one of the scariest things that you go through, because what goes through your mind? I have cancer. Oh my God, I have cancer. So I went down to my car and I just like felt like I lost it. I'm like, oh my God, what am I going to do? I have breast cancer. And then I took a step back once I got home, and this happened on I think a Thursday or Friday, and I couldn't get an appointment until the following week. So I just said to myself, what do you know? And so I did exactly what I teach women to do, as well as what I do in my clinic for women with breast issues. And I did it for an hour on Saturday, an hour on Sunday. By the time I got to the appointment on Monday, they said, well, where is it? I said, I don't know, it's gone. I said, it's not there anymore. So this pea-sized lump that you'll feel on that side was completely gone with 2 hours of the myofascial work. To this day, 8 years ago, it has not come back. And so I am grateful every day that I know this work, and this is partly why we have decided to do these talks and do the clinics, is because one of my story, I wanted to do something to help women, and I know so many women that go through breast cancer, and we'll talk about a little bit more about that in a moment. But going through cancer. So we have helped women during cancer treatment, as they're going through chemo, as they're going through radiation, after mastectomies, and as they have their expanders in before they get their reconstruction. What myofascial helps at that time is to help decrease pain. It helps decrease the discomfort they're going through. It really helps them to maintain, improve their range of motion, their ability to move their arms and their trunks. It helps also prepare their body for treatments and to assist in their healing. We also help them after recovery. I encourage women, we can treat women as soon or late after treatment. I encourage we get our hands on them as soon as possible. We do have to modify some things right after surgeries and things like that, but the more that we can help those scars lay down and eliminate the scar tissue, the better. Some women do also develop what's called cording, which is a thick corded tissue that kind of comes from the trunk down their arm. Myofascial helps tremendously with minimizing that cording. Now, this is where I also like to talk about things that I've heard from my clients. So I have a dear friend of mine who went through bilateral breast cancer at the same time. And, you know, and she's heard so many stories because she's so pivotal with helping women now through breast cancer. And the thing that bothers me the most is these women come in with true stories of, I have swelling in my arm, I can't raise my arm, I can't do this, or I hate how my breasts look, I hate how my body looks. And a lot of what these women hear is, but honey, you survived breast cancer. And that bothers me, because every single woman that goes through something like this should have a great outcome. They should love their body again, they should love their breasts and the decisions that they have. So what we want to do is really help women help themselves feel better. So I'm going to read something to you guys. This recently came through a forum that we're on. I actually know this woman. She's a fellow myofascial therapist in Michigan. I can't remember, so it was 12 years ago.
that she was diagnosed with an invasive ductal carcinoma. So let me just read what she had said. She goes, "Today I received the results for my recent mammogram as normal. It was 2006 when I walked into Paoli Clinic, which is one of the myofascial release clinics that the founder, John Barnes, has. She was feeling numb and exhausted after receiving a diagnosis of invasive ductal carcinoma. Through her week of treatment, feeling the tumor soften and reduce in size, she left feeling hopeful. My next scan showed the tumor had reduced in size, and the following mammogram didn't find a tumor at all. And she said, 'Thank you for sparing me from a mastectomy. That intensive started a healing process that I know many didn't believe was possible. But 12 years later, and I'm getting clear, normal mammograms.'" And she says, pretty awesome. This is someone who has been, I think this was her second bout of breast cancer. And she was adamant, "I'm going to do this treatment, I'm going to do this treatment." And her doctors wanted to do mastectomy. They kept pushing her to do mastectomy, and she kept pushing, "No, I'm going to do this." And she proved them all wrong, and she went in and they didn't believe that it had changed. So they kept going back and wanting to do more and more studies because they're like, "No, it's got to still be there." So there are people receiving tremendous results. Again, we can't really do much in that change when someone is at a stage 4 or something like that. But when we can catch these things early, the stage 0, right, Joe? We can do a lot about that. Let me just go back one thing. What I also wanted to say about my story with the mammograms. So for those of you that have had mammograms, who thinks they're really uncomfortable? Anyone? Okay. So, and from what I've been told, younger women, it's even worse because of the denseness of breast, correct? Okay. So when I went in, now remember I had done 2 hours of myofascial self-treatment on my breast prior to going in. It literally felt like nothing because of the amount of work that I did. My tissue was so movable that that compression did not cause any type of discomfort for me. So I do encourage that women, either you learn how to do this work, which is what we do help women teach, as well as, or get the work done pre and post mammogram, if you are getting mammograms, because it can eliminate a lot of the pain and discomfort that you feel, as well as Deb talked about the amount of compression. What that's doing, that's solidifying your fascial tissue. And so if we can get our hands on women post-mammogram and eliminate a lot of the effect that that has had on the breast, I truly believe that we can make change in the breast tissue and not have some of these things lead into potential malignant tumors. So prevention is number one. Now there were a few people that do self-breast exams, correct? Who does regular self-breast exams? So for those of you that do not, I am one of them. I'm going to admit that. I am one. What are the reasons that you choose not to? Does anyone want to share? Go ahead.
To me, you're supposed to be remembering what your breast was like the month before. Mm-hmm. Imagine having spaghetti and meatballs one night, and someone says to you, "How does this compare with the spaghetti and meatballs you had 2 weeks ago?
Yeah.
Do you have the same amount of oregano in there, the same amount of salt, the same?" I mean, it's just,
that's a great way to look at it.
you know, you can't remember what it was like before.
Exactly.
It's just a bunch of bumps.
Yeah. How about you?
The only time I really do the breast exams now is if the breasts don't feel normal, like they're a little sore, a spot doesn't feel quite right. I started mammograms when I was 16 is when they first started seeing the lumps, so they were doing mammograms right along. And I have such thick, fibrous breasts that to me they're all lumpy. It's lumpy all over. Yeah. So for me to feel, if I went in every time I felt a lump, I'd be in every other day because I'm always feeling lumps.
Yeah. And who is nervous about doing them because they don't know what they're feeling for, or they're scared that they might find something. I hear that all the time from women. The reason that I don't do self-breast exams is I don't call them self-breast exams. I don't call them my monthly exam because why would I believe kind of what you put out there you get. So why would I want to be looking for something wrong in my body? What I want to do is I touch and familiarize myself with my breasts very regularly. So I do myofascial self-care on my breasts. That is my version of providing love and support to my breasts. I would rather do that than look for something wrong. And so the more familiar that you can become with your breasts by doing it more regularly than once a month. You know, when you're in the shower, get used to what your breasts feel like. What is normal for your cyst? What is not normal? And then when you start to know what your norm is, when something is out of norm, that's when you then look and address it. So you can still do self-exams, maybe just do them more regularly. Just familiarize yourself with your breasts. So we provide, along with this seminar, we provide an opportunity that we do at Serenity at Deb's clinic. We call it the breast clinic, where women can come in and they can get a thermogram. And this is in your folders, you guys. There's a flyer on it. There's a thermogram followed by 30 minutes of myofascial release. Now that myofascial release can include 30 minutes of hands-on, where I'm just doing hands-on. It can also be where I am teaching you how to do this at home. Or it can be a combination. Whatever women want, that's what we do. We have 3 dates scheduled, which is in your folder, so we can talk about that a little bit more. But in summary, I just want to talk about how research is confirming what our founder of myofascial release has believed for many years, that when you apply prolonged pressure or pull into a tissue, the tissue starts to soften, the ground substance starts to rehydrate, and it improves the mobility and the environment for healthy breasts and cells. The other thing that's important, you guys, is everyone can learn this. You don't have to have any special skill to be able to do myofascial self-work on your own, and anyone can benefit. So we're going to open up to questions in just a moment, but we have a little humor. If anyone can read that, I will read it for you. This is if women ran the world. This is, instead of a mammogram, this is a manogram. And it says, okay, Mr. Smith, just stick it in between these 2 devices. I'm sorry to the only male in the room. So we're going to, if Kristen and Kayla and Deb want to come up, we're going to open up to any questions now that you guys may have.